means I specialize in treating headaches, neck pain, dizziness, or anything that comes from a head and neck misalignment. Today, we're going to talk about cervical instability, what it is, what causes it, and what we can do to help people who suffer from cervical instability. Cervical instability occurs when the ligaments that hold the bones in your neck together become loose. And this results in hypermobility between the segments of your neck. This results in a lot of musculoskeletal-like symptoms like pain, tingling, weakness, numbness. Some people also feel headaches, dizziness, or they feel like an inability to hold their head up because of how unstable their neck is. There are a few causes of cervical instability, the first being trauma, a physical accident or incident that happened that caused the neck to be so severely whipped that there is damage to those ligaments. 2, you could have a connective tissue disorder such as Ehlers-Danlos that results in loose ligaments and hypermobility. 3, you could have a genetic condition or a hormonal condition that has caused the ligaments to be loose as well. Patients who suffer from cervical instability often find relief getting low-force chiropractic adjustments. And I say low force because if you have a hypermobile segment, if you're putting more force into that segment, that will cause more mobility, more instability into that area. So you have to be very careful about deciding how much force you're putting into an area that is already hypermobile. So how do we help patients with cervical instability? Well, there are 3 steps and they must be done in this order. First, we have to fix the misalignment. Second, we have to regenerate as much of the loose ligaments as possible so that we can help create more stability in the area. And third, we do exercises. So let's dive into the steps a little bit. First, find a local low-force chiropractor to go and fix your alignment. The more specific the chiropractor, the better, because not only do you want a low-force adjustment, you also want it to be as precise as possible. So somebody who does objective tests before they adjust you, or somebody who does some sort of testing before they adjust you would be the most beneficial for you. Second, you want to regenerate as much of the loose tissue as possible, because if your ligaments that are holding your muscles that are connected to the bones are loose and you're not tightening those up or recreating more ligament to help stabilize that area, then that area is always going to be unstable. Our favorite thing to do in our office is low-level laser. That is a faster, non-invasive way to regenerate the cells in that area. Other options would be looking into getting PRP or even prolotherapy into that area to help regenerate as much as possible. And third, we want to build muscle, right? Now, why don't we want to build muscle first? I know that's always the first question that people ask. And the answer is, if your bones are misaligned and you build muscle in that misaligned position, that's just setting you up for more biomechanical dysfunction down the road. You cannot realign your bones via strength training. It must be done alignment first, then strength training after. To recap, cervical instability is a condition when the ligaments in your neck become loose. Patients who have cervical instability often suffer from musculoskeletal-like conditions such as neck pain, weakness, numbness, headaches, dizziness, etc. Some causes of cervical instability are physical trauma, connective tissue disorders, genetic disorders, or hormonal disorders. In order to correct cervical instability, we do 3 steps. The first, we realign the bones. Second, regenerate the ligaments that are loose as much as we possibly can. And then finally, build muscle. I hope this video helps anybody who's suffering from cervical instability find more clarity about where to go for treatment. Or if you know somebody who has cervical instability, please share this video with them so that they can have more information about their case and feel empowered to make the decision that's best for them. If you like this video, please give it a thumbs up and subscribe to my page, and make sure you hit that notification bell so that you know the next time I post a video.